So thank you everybody for joining today's PEDRI webinar. So PEDRI stands for Public Engagement in Data Research Initiative. And today's webinar is focused on how deliberative approaches can support organisations to make important decisions about data research and statistics in line with public expectations. So my name is Lizzie. I'm the Senior Engagement Manager within the DARE UK team. DARE UK stands for Data and Analytics Research Environments UK, and we're one of the partners of the PEDRI initiative. So I'll be chairing the session today. We have a panel discussion today rather than a series of presentations. So you can see the names of our excellent panelists on the screen, and I'll be introducing them fully shortly. But before I do, we just have a few housekeeping and other points to make. So next slide, please. So today's event is partnered with the Use My Data National Patient Data Day, which will take place on June the 24th. So across the month of June, Use My Data has invited organisations to join in with their own events under the National Patient Data Day umbrella to showcase and celebrate their work with patient data. So this event is falling under that banner. And on June the 24th itself, there will be 2 free public webinars celebrating the use of public data across the 4 nations of the UK. And these will highlight success stories, achievements and opportunities for health data research from the patient perspective. So please do keep an eye out for those events and sign up for those as well. Next slide, please. So there isn't really a single agreed definition of deliberative approaches, but for the purpose of this webinar, we have pulled together something from a few different sources. So I'll just read out the definition that we'll use for today. So by deliberative approaches, we mean an inclusive approach to engaging the public to discuss an issue in detail, to gain insight into the public's views, concerns and aspirations. And this allows the public to make informed decisions or participate in making informed decisions on complex topics. So we're going to be talking a lot more about what deliberative approaches are in this webinar, and I'm sure there'll be discussion about what it is and what it isn't. And any thoughts or comments on that, please do raise them yourselves as well. So that pretty much takes us to the end of the introductory slides. So without further ado, I'd like to introduce our panelists for today. So we have 4 panelists. First, we have Charlie Wilkinson, who's Community and Partnerships Manager at Understanding Patient Data. Understanding Patient Data works with patient groups, charities, NHS organisations and policymakers to bring transparency, accountability and public involvement to the way patient data is used. Next, we have Shabira Cassidy, who's the CEO and founder of People Street, which is a social impact organisation that brings together grassroots communities, researchers and organisations to co-design change. We also have Dr. Emily Rempel, who's a research fellow in participation and data practices on the Liverpool City Region Civic Data Cooperative Project, hosted at the University of Liverpool. The project aims to connect organisations and citizens in the Liverpool region to appropriate data in order to help improve service delivery and solve societal problems. And last but not least, Chris Carrigan is a data advisor at Use My Data, which is a member-led organisation with a mission to be a trusted voice for patients and the public in all discussions and decisions about the use of data for research and healthcare. So a huge welcome to our panelists, which I'm sure you'll agree bring a wealth of experience from across the sector. So I think it's going to be a really interesting discussion. So to start, it would just be great if you could each tell us a bit about the deliberative activity that you've been involved in and we'll be drawing on today during the discussion and what your role has been in that. So perhaps Charlie, you could kick us off.
I'd be very happy to. So as you so eloquently have already put it, understanding patient data, we try to understand and explore public views around health data and how it's used. And we particularly like to focus on underserved, marginalized communities that sometimes might not have their voice heard in that discussion, or might have unique challenges or complexities or barriers around access to healthcare or access and understanding of health data. So that kind of drives a lot of the work that we do from an organisation, and for this project particularly, which we're very lucky to be working with Shabira and People Street on the delivery of, we were really interested in wanting to explore the views and lived experience of people seeking refuge and asylum in the UK around access to healthcare and their health data and how they feel about that, because of those unique complexities and because of what may be deep rooted concerns that those communities have around how their health data may or may not be being linked with different organizations, or have been linked with migration enforcement in the past. And I think particularly at the minute, it's quite a volatile time. So this felt like a really important conversation to have at this stage. And we were very lucky to be able to work with Shabira to deliver this, which we're actually still in the process of. We're still in the midst of this engagement process. So it's interesting to see how it's kind of changed and fluxed as we've kind of worked through this delivery.
Thanks, Charlie. And Shabira, perhaps you can say a bit about your involvement in that project.
Yeah, so the program was co-designed with community researchers, and so it's called Our Health, Our Data, and it's a community research project that is led by people with the lived experience of asylum and refugee communities. My role is to lead the research alongside a team of experts who I think are online today. So I have to do a shout out to them. So there's a whole team of engagement leads and outreach leaders who have themselves lived experience of asylum and refugee. And we also have research leaders who support that process. So I don't do this on my own at all. They're the real engine of the project. And together we support and upskill people from within the community to be able to run the research conversations. To date, we've run 2 research sprints, and what a sprint is, it means it's a short research window rather than like a 12-month program of like collecting data over a long period of time. It's a sprint. It's very, very quick. And so we've run 2 research sprints, and in those 2 research sprints, we had research conversations with 40 people in each sprint. We've just completed one. We are just looking at the data that's surfacing from that. They've been across 12 UK regions, including Wales and Scotland. The first sprint had a lot of focus on London and the southeast. The second sprint had to be completely outside of London, so we can start doing some comparison. It's been in mother tongue, so research conversations have been in Pashto or Urdu or Arabic. It's been people living in hostels or dispersal housing, so it's people currently working through the system who have impoverished health literacy. And so understanding context, you can't think about how people feel about their data or data linkage without contextualizing their healthcare experience. And, you know, we're reaching people who don't traditionally have their voice either not only captured in research, but are creating, they design the research questions. So they're leading, so they're producing the knowledge that the research then leads us to think about the sticky issues.
Thank you, Shabira. It really sounds like a fascinating piece of work and much needed to tap into those voices. So, yeah, really looking forward to the outputs of that research. Emily, do you want to talk about the activity that you'll be drawing on today?
Hi, everyone. My name is Emily. As Lizzie said, I'm a research fellow at the University of Liverpool. For the past about half a decade or so, I've been working in the city region. And if you can tell by my accent, I am not a Scouser. And so what I say is very much on behalf of the people we've been working with in the communities here in the city region. But we've been working on a local government funded project around data stewardship and how we represent people. So we've been testing and trialing different kinds of participatory and deliberative methods on data and AI technologies over the past few years. But what I really want to talk about is the process we went through last year to run a more formal deliberative exercise called the Residents' Assembly on data and AI innovation for the Liverpool City region. And the express purpose of that exercise was to build a charter that was designed entirely by our community. We didn't come to them with a charter that someone else had designed that we talked to technical and policy experts about and then sort of sense checked with them. This was written and built by them through, as I mentioned, a formal assembly process. And that's been about how we negotiate a social license for our region, with the charter being those formal written rules on what beneficial and trustworthy data and AI use looks like. So that has included a lot of different project partners. One of our core project partners is the Data into Action program, which is the data service here in Cheshire and Merseyside with the NHS, but also has included the university, local and regional governments. And it's been a really interesting process to reflect on. So I'm excited to share more.
Thanks, Emily. Looking forward to hearing more. And last but not least, again, Chris, would you like to talk a bit about your experience with deliberative approaches in your work?
Thanks, Lizzie. So I'm an odd one out anyway, because I'm here from Use My Data, which is the only independent movement of patients, relatives and carers interested in the use of patient data to drive care, improve outcomes for everybody. So it's entirely patient-led, and all I do is act as part of the secretariat with others to do what they want us to do, part of which is coming to talk things like this. From my own perspective, I was going to approach this from two sides. One is my own experience in various different bits of deliberative engagement, and the other is about how Use My Data operates, because it is quite different. In terms of deliberative engagements, the good bits I've seen that I've been involved with, things like citizen juries, which will come up as we go through the conversation, I'm sure, which are highly complex things, take a lot of organising, but actually very effective about the impact of some of those things later. And I've been involved in those in the role of designing the juries, designing the questions, and actually then being an expert witness as well. So that's just some of the deliberative work we've done. Within Use My Data, again, it's quite different in that all the members are patients, relatives, and carers. They all have different views, they all have different perspectives, but they're bound together by this desire to get patient data used for research. And some of the things we do to bring their voices together are things like responses to national consultations. Would be a very practical example where all our members will feed in their views to me, and my job is to collate all their different feelings, thoughts, questions into a consolidated response, which by and large doesn't say a yes or a no, it doesn't give a simple answer, but it reflects the views of a variety of people who know something or want to know more about data. So they may not be typical members of the public, but we bring a range of views to that conversation. The other thing we do in terms of letting people deliberate things with our members is we run things like in confidence workshops. So any organization, any body can bring what they might think is a tricky question to us about data, patient data. And we run workshops with our members where they can simply talk to them and say, this is the problem I've got. These are the ideas I've had. What do you think? So it's absolutely not binding as other things might be, but it brings their voices directly to that process of working through problems right at the outset, rather than being presented with a potential answer at the end and picking holes in it because it's not being thought about from a patient perspective early enough. So there are lots of things we do, which is about involving and bringing our voices to very early stages of conversations around data, and then collating our members' voices. We produce things like position statements, which anybody can use, which are a position from the organisation as a whole that everybody can sign up to. And those have been quite effective in getting in policy, lobbying, and changing practice as well. So there's a range of different things we might want to cover off in the topic today.
Great, thank you so much, Chris. And just thinking about deliberative approaches as a method and when it is and isn't suited to a particular topic or issue, it would be good to hear a bit about why it was that you chose a deliberative approach for your various projects. So maybe starting with Charlie, could you say a bit about why a deliberative approach was the best for your project?
Yeah, absolutely. I mean, I think I'm an interesting one to start with on that topic, because what I would say is that, you know, in early stages of planning and thinking about this project, and I have to give credit to my friend and colleague Emma Morgan, who really was the kind of brainchild of coming up with this idea for a project and where we take that, but has since left Understanding Patient Data. We had lots of conversations in the early stages around the planning and development for this before we went out to look for suppliers to collaborate and work with. And even during all that time, I don't think we necessarily used the language deliberative engagement methodology. I think we spoke very openly about what this project should or could feel like and what the methodologies might entail, but I don't really think we used that kind of formal language exactly and made a decision of this is the methodology we're going to go forward with. I think, in fact, actually, what we knew going into it is that this is a complex topic and it's a sensitive subject, and it could bring up really challenging narratives that we need to give the time and energy and resource to be able to hold space to have those discussions. And we also knew that we needed and wanted to collaborate with a supplier that really shared our values and that we could work very closely with to to deliver this. So I actually think in terms of planning this and thinking about it, the challenge for us was about trying to create, I guess, like a framework or a structure for what this project could be, but not be prescriptive about what the methodology should be and how people should approach it. What we really wanted, and Shabir will be able to comment this, I don't know if we did it successfully, we really wanted to create the space where we could be led by the suppliers' expertise who could come in and be like, we know these communities and we think what needs to be done is this, and this is what the best way to engage them is going to be. And to really create the space where people could come and share ideas with us and we could discuss and think about what the best approach could be. So in terms of why a deliberative engagement methodology, it's not something that we went in with like, this is exactly what it's going to be. But I think the essence of what deliberative engagement is was kind of there, was there throughout those conversations, even if we didn't necessarily know or use that language from the outset. I think we knew we needed the time, we needed the energy, we needed the resource, and that really is kind of the essence of what deliberative engagement is, to give space to those complex issues. And we knew that we wanted to leave people that we're engaging with feeling more confident and comfortable with accessing healthcare and feel like they've got more autonomy in decision making and more clarity around those structures, and maybe have greater health literacy or just create those kind of like positive impacts. And to really be able to achieve all that, you need the kind of time that you get by taking, where are we now, 6 months into this engagement project, still working through this process and spending time with the people that we're engaging with and thinking about the impacts that we create across that entire process. So it's a long-winded way of saying we didn't necessarily decide on that, but we kind of have worked our way towards that process as we've worked through it and thinking about how we kind of structure those conversations.
Yeah, thank you, Charlie. And it'd be great to hear, Shabir, if you've got any reflections on how that approach kind of manifested and what the benefits were.
Yeah. Well, so we're in the business of ensuring that communities, and I mean that like, so I say communities and diversity in the widest sense of what that means. So like groups of people in the UK who are hooked into the voluntary sector, who wouldn't sign up to a database, who don't have an email address and can't respond to a survey on email, or so we're talking about a wide range of communities that are intersectional. So we're in the business of ensuring that those communities of people, wherever they are in the UK, they are able to participate in these conversations that they're often excluded because they're not designed for people experiencing their barriers. So our approach to deliberation, to public dialogues, is to work backwards. And so we know at the end, so in September, together with Charlie and the team, there will be what the community calls a community roundtable. So it's a round table style. But to be able to get there, there's all this pre-work, which some of the community research is part of, that we're building people's health literacy. We're building their confidence to be around the topic. We're contextualizing with them. So we're understanding the context in which people are going to ground and root their feedback. So if we're asking people to develop, a set of guardrails around how data is going to be linked, you don't go, all right, let's give this recruitment agency a criteria. They go off, they put it through their databases of the usual suspects, or we go through social media, we go through this database, or we do this survey, and then we'll get those people and then we invite them to a session. That's like the opposite of a people street approach, which is why Charlie and the team, why we had to apply for it, because they built in that time. And so the community research uses two functions for that public deliberation. First of all, it brings people to where we're at. And so in January, when we first started, people didn't know the terms health data goes together. And data was like what I get on my phone, so that when I'm going around, I can roam, and data linkage as a term, right? They might have used other words for it. It's not that didn't have any literacy around it, but literacy was quite poor around these communities. And so we needed to understand, where are the communities at? So instead of like coming in and going, this is where we're at, we need people who can be where we're at, which is a traditional way of doing it. And so we exclude people who can't keep up with us in a public dialogue session, for example. We go, where are people at? How do we design so we can bring them to start tackling the sticky issues that affect them the most? That's what we need to be most honest about. The people most at risk of being excluded by the thing that we're doing, they're the ones that need to be at the heart of it. And so we designed the community research. In June, we're going to now do 2 sessions community engagement, because data linkage is such a sticky, complex problem. You can't just do that one-to-one conversations. So we do one in Wales, one in the Southeast, and then we bring them together. So by the time they come to the roundtable, they've had like this drip feed, and then they come together with professional participants. So the way we run ours is not that they're in a fishbowl and the professional participants. So say you guys were going to come as partners in it. Emily and Chris don't sit there taking notes on people. They're there working with people. They're questioning. They're like, yeah, but what do you mean by that? And what about this? Oh, but in my job, and they question you. They're like, Emily, what did you do over there? How did that work? Did that work though when they were talking about the consent? And you're like, yeah, because we did this. So we work together. And for us, it works because at the end of it, we've improved health literacy, we've improved confidence, we're creating conditions for trust for people to engage more in these kinds of activities.
Thanks very much, Shabira. And I think it's clear that that data literacy is really important when engaging on complex topics. So I'm going to go to Emily next, thinking about learning. So Emily, maybe you can say a bit about how you embedded learning in your deliberative process as well, and what worked well for engaging participants with technical detail.
Absolutely, yeah. So I think, sort of building a bit on what Charlie and Shabir were saying, there is a sort of, a capitalized deliberation, and then there's a lowercase deliberation, and how you fit that into the ways of working and think about it. And I think in terms of the learning in our more formal assembly process, it was really thinking about how do we, even in the exercises we're designing for learning, think about giving people time and shifting power to them to make decisions, which I think are the two key aspects of deliberation that really differentiate it from other kinds of engagement methodologies. In Liverpool, we wanted to make sure that we were designing it for the people who were there. We actually spent a lot of time in the design. We spent maybe like 2 years informally and about 6 months formally designing the process, because one of the biggest critiques, I think, of the kinds of formal assembly processes that get done is that they don't think about impact. They aren't designed with community. They're just a top-down exercise trying to tell people to come, talk about something, and then they leave and it's done. And that is not what we wanted to do. So when we were designing learning, we thought both, from an academic angle, what ways do people learn? How do we ensure that we're giving them lots of different ways of thinking about the issues? That was interactive activities. We made a podcast about the assembly so people could listen to that. We had YouTube videos. We had things translated to different languages. We made sure that there's lots of different ways to get involved. And then it was about repetition. So we did first sort of take-home exercises for our residents who took part. We did a full day learning about basic concepts, and we did that again, and we did it again, so that people could really feel informed and have just that time to reflect on the issues. And I think the other big thing we did around making data and AI, in particular AI, more understandable, is setting it in the local context. We did not bring in experts from Microsoft or IBM to come and tell us about AI in any particular detail. Instead, we said, what projects are happening in the city region right now? How do we bring in the people who are running those projects to talk about what that looks like? And then offer our residents the opportunity in smaller groups, not just in the big assembly setting, to really sort of drill down into those issues. We did something called like a knowledge safari, which, worked fairly well, where we got all the experts and the tech people to sit at different stations and to do like a circular exercise where our residents could, in really small groups, go and just chat to them and ask all the questions. And I think the other thing is making sure that we're constantly checking in. AI is complex. I talk about it all the time in my job, and I am sick of it half the time because of that. It's everywhere right now, which means people come with a lot of pre-existing thoughts and questions about these kinds of data technologies, especially as they relate to their healthcare. So we had lots of opportunities for feedback. Obviously, we had things like formal evaluation, which was brilliantly done by Anna Beckett. But we also did things like have Post-its that people could stick up so they didn't have to ask a question, because we had a lot of people going like, I feel like I should know already what an algorithm is on day 3, but I still don't know. And so we did a lot of just check-in opportunities, surveys, everything to make sure that learning was sort of meeting the mark and also not being leading. I think temperature checking is the other half of this, right? I'm not there to say data and AI is perfect, it's good, it's going to solve all your problems. I'm there to facilitate people to come and give the different perspectives on the issues.
Thanks so much, Emily. And it would be great to hear from Chris on this as well as a patient representative. Is there anything that you think works particularly well in terms of learning and getting people up to speed so that they can contribute effectively to technical discussions?
Yeah, there's a few things I just want to pick up on. Probably two words, actually. The first word that you've heard from each of my fellow three speakers, the word time. If you're going to involve people and expect people to make a view, a judgment, a comment about the way their health data gets used, you need to spend some time with them to help them understand. I've been working in data for 40 years, and every day I come up against something that was new to me. So how we expect a member of the public to answer a very complex question is really tough. So things like national surveys, which go out to do consultations in the street with the big polling agencies, you'll get a result back. And it's interesting because it gives you a feel what the nation might think, but it actually doesn't really help you that much into detail until you spend time with somebody. As Shabir said exactly right, talking with them, working with them, having that dialogue about how things work. It's very difficult for anybody to understand. You mentioned data linkage as a good example. So one thing we do with our members, we run education sessions once every 3-ish weeks on a topic. We've done one on data linkage where I will sit in an online forum and say, this is what data linkage is about. What do you think? What are your questions? What troubles you? What's your aspects to it? So we run those all the time to give our members more of a background knowledge so that they can play more active roles in the work they do around the communities. So quite practically, that I think really helps. But it takes time and energy and effort. And if you compared, for instance, the amount of money we spend on big technological investments versus the amount of money we put into proper involvement with people, public and communities about their data, it's a tiny fraction. And yet it's the thing which always trips us up. So generally, I think that's where it needs to be learned. That we need to invest more in the time to have that dialogue with people, to help them understand, to answer their questions, and then actually to let them flipping lead, because it doesn't need people like me ranting. It needs to have patient voices, public voices out there in the locality, in hospitals, in the communities. They're the ones who are beginning to spread the message about positive use of data. So there are a few things we practically do with our members. I did mention juries before. So the citizens juries I've been involved with are quite different beasts. They're very, very well structured. And they take a long time to set up, and they're there to answer one question. So rather than saying, what do you think about patient linkage? They're there to answer one very specific question. So it takes time to build up from all the jury outputs what the general evidence is, but they're very, very useful in amongst all the other work that you've heard described here. And the last thing about all this work is the problem that trips us up again and again is the lack of ability to communicate what health data is, how it's used, what your choices are. So that inability for people at the, let's say, the highest level, the leaders of the establishment, to communicate clearly what this is all about and why is gone, because they always approach it from a box, a wires, a data, a beast, a database side, rather than saying, you know, we can actually save 50,000 lives a year if we do these things, but we're going to need your support. Would you like to understand more about it? And really approach it from the ground up. And that's what we and others try and do. It's exactly what Shabir is describing far better than I do.
Thank you, Chris. And you spoke a bit about evidence there and the evidence that is built from these deliberative processes in terms of public views. So just thinking a bit about impact and the impact that can be had and the real change from these important conversations with the public. It would be good to hear about how you all feel that your work will impact or could impact change as a result of these deliberative processes. So maybe starting with Charlie, I know that your work's still in progress, but perhaps you can talk a bit about what impact that you're hoping for.
Yeah, absolutely. I think again, it's we've had an interesting approach to thinking about impact, and I think really I could probably answer this on two fronts, which I think is important to consider when you're engaging with members of the public and communities, is that it's not just the impact of like, I'm going to create an output and then that's going to create impact somewhere, but it's about thinking about impact at all elements of this approach and this method. So we're thinking about the impact that we have on the people that we're directly engaging with. And I know this is something that me and Shabira talk about constantly, is this idea of leaving people in a better place than we find them, and these ideas of, you know, better health literacy, or confidence in systems, or more autonomy, or you know, feeling that your voice has been heard, is so important to me when we come to engaging with communities. And it's been something that really kind of drives all of the little decisions that we make throughout the process, all the way to the beginning of writing a tender and thinking about the suppliers that we engage with, and the early conversations we had before we even wrote that. You know, that was something that we really considered throughout all of it, is thinking about the impact that we have on the people that we engage with, especially when it's a complex and sensitive issue. And then I think you've also got on the other side of that the kind of wider impacts that you can have across the system. And much like our not wanting to be too prescriptive in terms of the approaches that we take to how we engage, we have the same idea around the impacts that we have, and we haven't been too prescriptive about the output of what will come out of the other end of this. And that's purposely so. We didn't want to go in with an idea of, and what we'll create at the end is an animation, or what we'll create at the end is guidance for healthcare professionals. Because what's really important with something like this is, as you know, has been a through line throughout many of the discussions today, is that it coming from that public voice and it being community led. And I think that needs to go into what we create at the end of this. We know we want to create a positive change, and we want to create a positive impact that you know, positively supports these communities that we're engaging with. And we really want to do something tangible that honors the experiences that people have shared in these spaces. And we don't want them to feel like it's fallen on deaf ears, but the exact tangible thing that comes out of it, and what that exactly looks like, is very much something that's going to be led by the communities that we engage with, to the point that this project that we're currently working on with People Street is very much just about surfacing insights. There will be a whole separate pot of funding that will support the development of an output or a resource, or whatever it is that we identify as being the gap in the support, or where we can create the biggest influence in advocacy on behalf of the communities that we're engaging with, as a separate piece of work. So we purposely kind of split it out so that we can really give the time for it to be driven by the people that we are kind of currently working with through the delivery of this project.
Thanks, Charlie. And it would be good to hear from Emily, as someone whose work has completed. Did you experience the same? Did you kind of come out of the project with very different outputs and impacts to what was expected? Yeah, it'd be good to hear from you, from your perspective.
Absolutely. I mean, we thought a lot about impact, as I said, sort of alluded to when I was chatting earlier. The worst case scenario for me, a very bad deliberation. Oh, there's a dog. A very bad deliberation is one that doesn't think about what happens once the last person leaves the meeting room on the last day of your last session. So we spent an awful lot of time with our evaluator and with our stakeholders thinking about what that looked like, and talking to our community and making sure they stayed engaged throughout the process. We're 11 months out from our final launch of the charter now, so I've had some time to reflect on what that has meant. There's some things we planned for and therefore they happened, and there are some things I think were quite unexpected. We did a lot of thinking about how we reach the wider community, because ultimately, when we're talking about power shifting, and we're doing it with those sort of 60 people we engaged with, that was very important, and they got that decision making, and we did that process. But there's also then a job to be done on awareness raising on the wider issues, both on what we did, but also on the issues of data and AI in the region, to establish, as I mentioned, that social license. So we did communication campaigns. We reached about 2 million people with those communication campaigns, as you know, as the sort of kind of social media metrics go. In terms of the region, we developed that podcast, released that, advertised that podcast. We did a lot of reporting. We did something we called the Charter on Tour. So we took the charter all over the UK, and we took it around the city region into different community spaces to make sure that people just knew that it was happening, and that therefore, if they knew it was happening, they could kind of hold us a bit more to account, right? Both on the issues we were talking about and making sure that we delivered through on what we had promised. And we did a huge festival earlier this year in which the charter was like the core focus, and we got, you know, tons of like year 11 children in and youth in to come and talk about the work of the charter. So this wasn't like meeting done, charter developed, off we go. There was just a massive like set of work that's happened. And I think some of the impact in terms of policy, and I think this is hard to state how big a deal it is we got all of our civic partners in the region to sign on to commit to the charter and put it into their governance processes, which was a huge win for us and came from a lot of relationship building with them and working with them very closely. I think the second thing was socializing the charter, which we sort of succeeded in and did. But I think the bigger thing that we don't talk a lot enough about, and I really take Charlie and Shabira and Chris's points on this, is that what happened to the participants? What did it mean for them in their lives, and how did they come out of it? And we've had some really wonderful stories. You know, people got jobs off the back of that. I ended up writing reference letters for some people who've taken part in our participatory processes. But I think more than that, the sort of most important story to me was one of our residents came in really, really worried, and I think reasonably. I'm not there to tell someone they shouldn't be worried about the impact AI will have on their healthcare or their government. That is something to be concerned about, right? But they said they also came in thinking, what's the point of a deliberation? I'm kind of here to be a bit of a disruptor. I'm here to show you that not everyone agrees with what you're doing, which again, completely fair. And at the end, they told us that this had like reinforced their faith in humanity, and they saw the value of deliberation. And I think things like that are really hard to understate. And you're not going to measure that in a policy impact statement, but it's something that we've taken forward and thought about how we try to continue the good things that came out of that process.
Thank you so much, Emily. I want to make sure we have plenty of time for audience Q&A as well. So before we move on to that, it would be good just to hear, based on your experience from each of you, if you've got one key piece of advice for teams considering deliberative approaches. So maybe I'll start with Shabira.
I thought about this question and I had like 10 things. And I was like, no, Lizzie won't let me say 10 things. So I'm just letting everybody know there were 10 things, but I'm not allowed. So the one thing, besides make sure you have a doggy, is start with trust, not with a question. So if you start with building trust, you're creating the foundations. And Chris is my new best friend, and so seeing what like what they've been doing of like making sure that you're taking people along the journey, doing the training, building relationships, as Emily's also said. If you start with building the conditions for trust, then people are going to surface the insights, they're going to surface the exclusion, they're going to tell you things that they won't tell other people in traditional research settings. For us, it's through the community researchers because of the lived experience, but the language, it's rooted in community, and the cultural attunement, but we're all humans. And the more I do this work, the more I see it's not just for these niche communities over here. When we did the public dialogue up in Newcastle, white working class communities, everyone's saying the same thing. And so we need to go back to those relational qualities. And then the co-design ends up being something that's thoughtful, that's inclusive by design, it's accessible, and we take people with us on the journey.
Thank you, Shabira. Really important points. Thank you for making one, but making it very well. Chris.
Oh gosh, I had another 10. I won't say anything that Shabira said. I think that for me, the one thing that I think we could do as a society to improve all our lives, to improve the lives of patients, to help us use data much better, is maybe to invest in things like education. So you could imagine if we had a proper health data literacy going across the schools, across communities, at that early level of people's lives, we're building for the future. So at the minute, we're in catch-up mode. So if you're asking me one thing, I would say that. I'd also say, if you're doing any deliberative engagements, think about how you could use it outside of your small world as well, because what we don't do collectively is capture the voices of everybody that said everything in a place. The nearest we've got is understanding patient data, trying to collate public evidence. I think we need to build on that and think about how we bring all our evidences about what people have said and what they've instructed us to do in their comments into one place or one way of finding something. I think that's a challenge for all of us on this call and on the webinar as well.
Thank you very much, Chris. So I've got trust from Shabira, education from Chris. So Charlie, what would be your one key piece of advice?
So my one key piece of advice, I think, and you probably guess from the amount of times I've said to not be too prescriptive about the various elements of this project, but I think, and I appreciate it sometimes can feel quite uncomfortable to be in that space of going in, not having like a fully fleshed out plan of exactly what a project's going to look like. But I think building in the opportunity for flexibility to be directed by the dialogue, to be directed by the conversations, to allow those conversations to maybe take you in a direction you didn't initially expect going into the start of a project is so important for this. I think it's been really interesting working on this project with Shabir and seeing how things have changed and fluxed, and discussions have taken us into different but like really rich places that we maybe didn't expect. And I think it's really, and that's only been possible because we've built in this flexibility to be able to do it. And if I may chuck in a second one, I would also say that, you know, the collaboration and shared learning and working with people who know more than you is such an exciting place to work. And again, I think sometimes we can have a hesitancy to admit that we don't know everything and to work with other people, but exploring this place of shared learning, I can't stress how fantastic it's been working with People Street and the entire team over there, and not just the impact it has in the communities because of the work with them, but the impact it has on me as an engagement professional, and the amount that I've been able to learn and how it's improved my practice. I think it creates so much benefit when we create the space to work collaboratively together and learn from each other as well. Sorry, I know that was two.
Well, that was great. Thank you very much, Charlie. And last word to Emily before we move into Q&A. Any last pieces of advice?
I'm just going to say Charlie took mine. No, I'm kidding. No, that was, I think that I'm an academic by training, but I worked in public health a lot as well in deliberative and engagement spaces. And, I tend to oscillate between being very critical, writing my academic papers is how it should be, X, Y, Z, to the very pragmatic side of how do we actually get this work done and what does it mean to people and how do we be empathy and person based. And I think on the one side, there's a lot to learn from publishing what you talk about. So read what other people are doing, learn about it. I'm sure there's lots of practitioners and public advisors on the call who have experience to share. So similar to what Charlie was saying, but I think the second half about being pragmatic, I think the number one thing when I talk to people specifically in probably policymaking settings is they like to say the public is like ambivalent. Why should we talk to people? They don't, they don't really care, which is we all know is not true because we care and we're people and we're part of the community. And it's just to think that you can do deliberation in a way that meets a community. And if perhaps you're coming up against an ambivalent audience that you perceive to be uninterested, maybe that's because you're not quite doing deliberation in the right way. As a bit of a challenge. And I know perhaps we don't have that audience on the call, but I think it is very important to remember that we're often, this is going to sound really bad, guys, but we're fighting the good fight.
Thank you very much, Emily. Perfect word to end the main bit of the discussion on. So we'll move into the audience Q&A. So I can see there's a few questions that have come up already. So I'll start with a question from Jackie, which asks, would you say that we need to go to the customers, inverted commas, and try to organise engagement events in their own spaces? I include people served by the Deep End initiatives. I'm not entirely sure myself what the deep end initiatives are, but I guess the question's around the importance of going out into communities and should we be going to people rather than expecting them to come to us. Would anybody like to kick us off with that question?
Sorry, is the customer like Charlie? Like Charlie's my customer. Are we saying, can you just qualify that we're having the same definition of like customer?
I think you can read it how you like. So would you say that we need to go to the inverted commas customers and try to organise engagement events in their own spaces? Is the question from Jackie. So I read it in this context, the customer being members of the public, unless anybody has another thought on that. Yeah.
So my first thing that I would do is I'd problematize that terming, because for me, the customer is the person who's paying me to be able to do this work, and communities, the public, they're not our customers. They're not paying for us to be able to do this. And the reason that's problematic for me, and the reason I'll bring it up just to help you think through this, is there's power dynamics and there's an exchange, right? So Charlie being my customer, there's a power dynamic between us. I'm producing something for him that he gets to stipulate, and there's an exchange there. And so we need to disrupt who holds power when we're doing public deliberations or any kind of public engagement where we need to deconstruct the power dynamics of and who are the creators of knowledge, who are the producers of knowledge. And if you keep those dynamics where you hold the knowledge and I am you are my customer and I'm giving something to you, you're creating supplicant recipients of the thing that you're doing. So you want to first disrupt that and think about your framing of it, because the bias within your framing is going to influence the design of the thing you're going to do. And then, yes, you should go to where people are and not expect them to come to you. But I say that thinking about balance, because a lot of the time we go out into community and you go and do that work and then you go away and you become a faceless organization. So yesterday I emailed Charlie. Now, Understanding Patient Data don't have a big office, but they have contacts. And so what happens is the nice, lovely, big NHS buildings or system buildings, Joe Blogg, the Shabiras out there in the world, they never go into those buildings. They don't know those buildings exist. And then the NHS or the system becomes a faceless, like Understanding Patient Data can become faceless. And so actually there's a call for being able to go out to people, but also then create the conditions. And so at the end of all the work that we're doing, so we're all going out to the community, we're going to Wales, we're going to run these things in community settings. And then at the end, we're trying to have the large public dialogue in a public building in places that people usually aren't invited to and not allowed to come. And we're like, Charlie, can you help us see if you can find a space? So that, because we're creating those conditions for trust. So there's both. But you have to do the first. If we didn't go out to people, then you shouldn't expect them to come to you. But it's because we're doing it that way. And then we're saying, and you know what? Come in here, have your say. You are welcome here. You are respected here.
Great. Thank you very much, Shabira. Did anybody else want to come in on that question before I move on to the next? Chris?
Only briefly, I think in the world of Zoom and Teams, it's been easier for people to get in one space, albeit a technical online space, but you do lose a lot of that personal interaction. And from our members' perspective, they often said they really value the fact that you can get in one place to have a proper dialogue. This is just for our work. So I think there's a mix we need. You need to be online makes conversations accessible to some people who might not be able to travel. In-person ones, you get much more dialogue, much more effective communications. The problem we got with in-person ones, they're so darned expensive if you're not careful. You've got to find someone, you get people to go there. You may even have to pay for their time, and things like that take a lot of resource and need to be thought through. So I think there's a balance. If we could do more in person, if we had more people to do it, if we had more funding to do it, then I would suggest we do more in person as well as doing remote as well. In the way we work, which is again quite different from the work that Shabira does. But I think you need a mix. It's not a simple answer.
Thank you, Chris. Yeah, benefits, pros and cons of both, and both have their place, especially in COVID. Online was a huge help to keep conversations going. Okay, so I'm going to move to the next question, which is anonymous, and that asks, in my experience, recruitment and continuity are big challenges in deliberative approaches. How do we bring people in and keep them involved meaningfully? So I think that's a good segue from the previous question. Emily, do you want to kick us off?
I can guess. I mean, I suppose it depends on your commissioning setting. I know there are different perspectives on compensating participants, but for our project, we always pay people for their time, understanding the issues that causes with benefits and communicating that with them and talking through that with each participant individually on how that works for them. So it helps a lot if you compensate people, you cover their travel, you put a creche together so that if they have young kids, they can still take part, you cover their caring responsibilities. I think the other important thing is that the deliberative exercise needs to be set within an intention for a continuity of process from the beginning. Anyone can run a deliberation. I could go out tomorrow and run a deliberation on whether or not I like the streetlights down the road from me instead of a roundabout, right? The idea behind this is that you're embedding it in a system and you're trying to create change. And so that continuity should be baked in from the beginning, right? And what that looks like and having that clear, not just communication plan, but also that impact plan we've been like incredibly lucky to be able to embed our deliberation into a wider participatory project. Not everyone is that lucky. Not everyone can do that kind of work. As you know, Chris saying, this stuff takes a lot of cash to keep going, but there are smaller ways to do it in a way I think that makes sense. And I might end there because I'm sure other people have thoughts on this one too.
Thank you, Emily. Would anybody else want to come in on that one? Charlie?
I mean, just to add and build on that, really, I think there's also an important consideration around putting thought into how you create comfortable spaces for people to be able to engage with these conversations. I think it feels like a small element of like planning an engagement project, but like putting thought into like when we've already touched on it a little bit there, but the space that you're hosting the conversations, a group setting versus a one-on-one, exploring like creative ways of being able to engage people using like creative arts practitioners as a way to be able to kind of engage people in the conversation. There's so much that you can do to create a space that feels comfortable, that feels safe for people to be able to share, but also create a space that people feel like they want to come back to time and time again to continue those conversations. I think those considerations can sometimes fall to the wayside a little bit, but actually it's a really important part of the engagement process to actually meaningfully create that trust and create those relationships with the people that you're talking to.
Thank you, Charlie. So moving on to the next question. This is from Lydis, and this asks, I think this is in directly to Chris in the beginning as well. So it says, thanks, Chris. Excellent point about the need to invest time to enable people to learn about complex topics. To be able to take part in a meaningful dialogue, how much would you make this case for funders to fund such projects in the longer term, who usually think in short term, the fastest and cheaper the better? So, Chris, do you want to kick us off?
Oh, yeah. Well, if I knew the answer to that, I'd be doing a lot more work. It's a real problem. What we found in recent years is the large funding bodies have certainly invested time in patient involvement, PPI, patient public involvement and engagement work. So if you're going to put a research application into a funding body, they're expected to have an element in there that says, what PPIE are you going to do? That's really good. That has changed significantly. There's a bit of a problem with that, and it becomes very pocketed. So you might have 100 different research teams working across the university, each with their own patient involvement bit. They never meet. So there's no dialogue, there's no shared understanding, there's no shared experience. So there's a lot of people out there who are working in this space who are just not collating well enough. Now, to a degree, that's what Use My Data is trying to do, to give people a single place to go, irrespective of whether you're working in a community, on a research project, on a data access committee, or just interested. We provide that safe space for people to come and learn more, to hear more, and be active if they want to be active, and just listen if they don't want to be active. But funding that, it'd be really hard. And we went to the wire in April. We were within a couple of weeks of probably closing down. And with various support, different organisations, Understanding Patient Data, being very vocal about how they want us to continue. And people like Cancer Research UK, very forward thinking about their long-term use of data. They want to invest in people like us. But it's really hard because the major funding bodies are not geared up to fund an independent patient movement who could say, we don't think you're doing the right thing. That's what being independent does. You have to speak truth. You have to be transparent. And sometimes transparent means bad news as well as good news. So it's quite a difficult thing to fund, and it remains that way. What has become much better is the amount of funding that has been put into PPIE projects and activities, which has moved things forward. But my problem is we're not collating that as best we could. It's all quite fragmented still.
Oh, thank you, Chris. Any further thoughts on funding? Otherwise, I'll pick up the next question. There's lots of them, so thank you all audience members for engaging in the discussion. So the next question is around data literacy. So what happens when participants have very different levels of data literacy, and how is that managed? It'll be great to hear how this was handled across the projects. So anybody want to kick us off around managing different levels of data literacy?
I'm happy to jump in and just say I talked about it quite a bit, but some of it is just assuming everyone knows nothing to get started. I always do that. I'm never starting an exercise going, okay, let's figure out what you know. We start with, what is data? how do we understand what it is, not like giving a definition and then it's building from that and designing experiential learning, reading-based learning, watching-based learning, and thinking about all the different ways people can engage with the materials. But it's a challenge, it is, but I think it's an overcomable challenge. That's not a word. It's fine.
Can't be a word. I liked it. Any other thoughts on data literacy, Chris?
Well, I mentioned our education sessions, which we run very regularly. Something which we've been trying to do for a while, and it's definitely in my list of things to do, is a fairly simple introduction to data things. So we've probably got the materials there, but some small 10-minute snippets right the way down to basics. So anybody who's got a degree of interest in data has got somewhere to go to listen, to watch something, to get started. We're desperate to try and get that done, but resource and time is a real killer for us. But I think I shall challenge myself to get it done faster. I think that would be generally really useful and completely shareable and completely free, because it'd be small snippets that could be used in a whole bunch of communities. And equally, some group of people might say, I don't get it. It makes no sense to me. Okay, great. Can we work with you to develop something which does make sense to you, and let them do it and let them speak about it? So I think we need to invest more in that. And that's a challenge we've got. And it comes down to time and energy and resource and money, frankly.
Thank you, Chris. I'm just going to pick up one final quick question from the chat. I think that's all we have time for. So this is around the point made about community-led outputs. It asks, given time constraints and potential misalignment with organisational objectives and expected outputs, how do you manage that in practice? Shabira, did you want to come in?
Yeah, that's a really good question. First of all, I've been doing this for 20 years, and I'm yet to find that there's completely misalignment between the bottom up and the top down. And that's because there's no such thing as a system without people. There's no such thing as an organization. An organization's made of people, and same with the communities on the ground, they're people. And the people that work in a hospital, for example, they live in a community. And so they're bringing all their lived experiences. And so there's usually, so we have one of our very first reports was uniting bottom up perspectives with top down perspectives. And so what you do, and so we do this with Charlie all the time. Like there are things that people want to speak about and need to speak about because it contextualizes what we're hearing around data linkage and data, health data, but they need to contextualize their experience, sometimes often really bad experiences of accessing healthcare. And so they will bring it up. And if you just saw that by itself and I came in and I didn't understand that it was context they were giving us, I'd think there was a misalignment between people wanting to talk about how bad experience they're getting from accessing GP, for example, and Charlie wanting to understand how people feel about their health data. But as soon as you start looking at the context, you start to see that how people feel about the health data is contextual to their experience of accessing healthcare. And so actually you just need to open up the lens through which you're seeing your data and allow for these concentric circles and stop pinpointing this thing that you want to see. When you come in with those narrow questions of like, I only want to know this, you're missing out, because when you get people's attitudes, you're not going to understand what the context is around it. And it doesn't matter how clever, how kind, how left-leaning, how open we are, how well read we are, we can only see the world through our own particular lens. And so if you're making judgments about the data that's coming to you from a research process, from a public dialogue, based on if you're only doing it through your lens, you're going to miss out the gold. And so for me, it doesn't exist a full misalignment. If you're seeing a full misalignment, go back and look at the data. Invite people around the table with you who are doing the sense making to have multiple perspectives. That could be interdisciplinary. In Emily's case, it might be if she's a social researcher, she might get someone else from a different department and do transdisciplinary work or across sectors. But invite people who have a different lens to help you see it, because I haven't seen it in 20 years. And that's what's so beautiful about it, because when you can unite and then you get people around the shed, there are going to be things, tangential things like I'm worried about this and I'm worried about that. But if you find that and you connect and you bring that to the public dialogue, magic happens. Absolute magic happens. So great question, whoever did that, anonymous.
Thank you, Shabira, and a great point to end on. We have unfortunately run out of time. So, just to say a huge thank you to our panelists for joining us today and sharing your wisdom. It's been a really interesting discussion. Thank you to everyone for putting your questions in the Q&A and for the discussion. I saw there was some discussion in the chat as well. And just a final note before you run off to please share your feedback about today's event, and that'll help the Pedri team with arranging future events as well. There's a link that's gone in the chat. So there are some upcoming events. I've mentioned already the Patient Data Day on the 24th of June, so please do register for that. And the next Pedri webinar will be on the 21st of July, and that will be on information governance in data research. So please do sign up and continue to attend the Pedri webinars. So yeah, thank you so much, everyone, and we will close the event there.